Hello, friends. A very good day to all of you out there, and a very, very warm welcome from the entire team of RCPI tutors, your mentor this side. I hope everybody is doing great. Thank you very much for joining in. A warm, warm welcome to two type of audience today: the ones who are getting ready for November 2025 and who are all set, but still we are waiting for the acceptance, and we are just thinking, when in the world are we going to get acceptance? Thank you very much. Fatima is on time today. Hello, Khadija. Big hello. And the second audience which I have today have just taken their written exam, but they are eager to learn about the Mrcpi Osce. So warm welcome to the February 2026 batch as well. Hoping that you all would get the seats and the passing results before that, of course. Hello, Sitwat. How are you, Mizra? Big hello to all of you. So both of you are anxious. The November batch is anxious because I know the time is less, and still we are waiting that when are we going to get the exam seat. And the February batch is anxious because we are still waiting for the results, but we don't want to make it a delay and we want to have the preparation starting. So I would like to say to both of you that it will come on its time, but nevertheless, every single day we should keep on improving. Every single day we should keep on getting better. And this is how the journey keeps on moving. The question which you guys ask, Rohina, thank you very much. The question which you guys keep on asking is, thank you, Sai, it does seems that way. How much time is enough? For those who are starting with the fast track now for November 2025, I would like to say that still, if you start today, you will be able to manage because it's such a comprehensive and organized course, and you're going to complete all the stations that are there in the last 6, 7 exams in the fast track. It's absolutely fine. The ones who are taking in February, it's absolutely sufficient time. We don't need more than this time. At the end of the day, when the acceptance comes, oh my God, everybody is on, like, speed of this. There have been so many shining stars all over the world, from the mock exams Abu Dhabi, from the mock exams Ireland back to back, from the mock exams Oman, from the mock exams Riyadh, wherever the center have been. I'm sure that you guys will be part of them when you'll start speaking. A little hesitation we all have in the start, but then we all become stronger and faster. Now, we do know that the seat for the exam in November, many of the students from the September exam also, they want to take the November exam. So this is given in the RCPI Obs and Gynae MRCPI Royal College of Ireland site. We have in Riyadh, and we are just waiting for the closing date, and after that we are expecting. You should be knowing that this exam is 31st and 1st of November, and you all know about the mock exams you're going to have on 29th of October in Riyadh, and we are going to meet in Ireland 25th of October for the mock exams and a complete full dress rehearsal of the exam, the same simulation, the same circuits, the same long case. I'm sure it's going to be helpful for you guys. And for those who are appearing in February, most probably it would be Oman, but we are not very sure at the moment because till date it's not been announced. However, we will start the applications quickly after the attempt of November exam. All right. So Mia, for you, acceptance is high, and for all those who have had the last non-acceptance, definitely the ones who have passed in March 2025, they have higher chance of acceptance this time. Part 2, OSCE, any exam? No, Saima. February is always overseas, sweetie. It's never in Ireland. However, May and November are in Ireland. February is always an overseas center, friends. Okay, right? All right, I hope by this time you people have had the introduction in the YouTube and you guys know what is Mrcpi Osce all about. You know the details of Mrcpi Osce. But just to revise that Mrcpi Osce has got one eligibility criteria only. And what's that? And what's that? That you have to be a successful MRCPI written candidate, right? So you all know that this is something which is an eligibility. Only those can appear in OSCE who have written exam clear. So we have got two sets of exam, ladies and gentlemen. We have got a circuit and we have got a long case. The circuit is 7 stations. We have 8, but one is the rest station. And then we have got one long case, either obstetrics or it's going to be gynecology. You all know about this. Generally, for the last 2 exams, the long case is earlier, but you never know. At times, they can make circuit first as well, depending upon the situation. You guys should be knowing about this. So, because it's a clinical exam, it's all about communication. The long case is 25 minutes, fully observed by 2 examiner. One of the examiner is going to take history examination, and the other one is going to be taking the investigations, differential diagnosis investigations, and the management after the diagnosis. Both examiners passing the long case for you guys is very important because eventually it has to be Shazil. Long case is always 2 examiner. All of you, please. When we talk about the long case, it is always 2 examiners, right? One, both are sitting together. So this is the table for the long case. You enter from here. Here is your chair. Here is your patient, the role player. And here is examiner number 1 and examiner number 2. Examiner number 1 is responsible for history and examination. And examiner number 2 is responsible for investigations, differential diagnosis, investigations, diagnosis, and the management plan of the case. Am I clear? And here at the back, you would have the examination couch where the mannequin will be, and you're going to go step up and do the examination there. Could I make myself clear? Make sense, everyone? Always long case is 2 examiner. Circuit is with 1 examiner, and you keep on moving from circuit to circuit in 10 minutes time. All right. So this exam is the same pattern for many years since the COVID. Before that, it has to be different pattern. But since COVID, the exam pattern have been the same. Until date, it is the same. Big hello, Shweta. Thank you very much for joining in. I repeat once again, you've got 7 circuit stations. 6 circuit are the structured discussion, all of you. And 1 is going to be what? 1 is going to be with the patient, simulated patient task. Big hello, Sarah. Thank you very much for joining in. Long case is only 1, and that is either OBS or gynae for the patient. Simulated task will be there. 25 minutes will be there for the long case. 10 minutes will be there for the circuit, please. Right? Okay. So SPT, Shazil, when it comes, it is either a breaking bad news or like IUFT anomalies, or for that matter, it can be malignancies, a cancer diagnosis. Moreover, it can be any communication where angry patient is there, upset patient is there, or sensitive cases can be there, like sexual assault nowadays. It's favorite of RCPI. It can be a sexual assault. Anywhere where communication is a challenge, they tend to give that 1 station, because in the entire exam, patient communication is only at 2 places. Number 1, in the simulated patient task at the time of the circuit, or the long case where you just need to take a history and move further. Am I clear? Did you guys understand the complete exam? I'm talking to all the newcomers for February, and I'm talking to all those who are taking the fast track and just ready for the acceptance, please. This is the whole exam. Okay, when we say SD, SD stands for it is a structured discussion. What does that mean? That means you and as a candidate plus examiner. That's it. Okay? No role player. When I say SPT, that means simulated patient task. There is going to be a lady or there's going to be a man in case of subfertility. Often a male role player comes, male subfertility. So it's going to be an individual who would be simulating that patient. That task would be there. There, it's going to be you as a candidate. There is going to be an examiner who would not speak, who would not speak, who would just mock you guys, and all the communication is going to be by a role player who would mimic to be that patient which scenario is given to you. So this is the whole circuit. These structured discussions are 6, and this simulated patient task is 1. So a total exam is of 7 plus 1 rest station for 10 minutes. Each circuit station is 10 minutes, which includes your reading time. Rohina, Elizabeth, my love, Samra, we don't have a separate reading time, guys. When you enter, your 10 minutes start, so that includes whatever you're going to read, whatever time you're going to take for the reading is part of those 10 minutes, which is different from MRCOG. In MRCOG, reading time is separate, and then we have a separate time for the presentation. Here, 10 minutes are complete for you guys. So what happens? You enter into the cubicle. This is like 1, 2, 3, 4, 5, 6, 7, 8. So you are here, 10 minutes done, you move here. 10 minutes done, the bell rings, you move here. 10 minutes done, you move here. So out of these, 1 rest station would be there. For example, the station number 8 is a rest station. So who would have it wheresoever will have 10 minutes rest and you keep on moving. So for example, if somebody is starting from station number 7, will go to 8. 8 will go to 1. 1 will go to 2. 2 will go to 3. So you keep on moving. If somebody is starting from station number 1, will end at station number 8. The circuit will end. If somebody is starting from station number 2, will move the whole circle and end at 1. Did you guys get it? Did you guys understand? 1 to 2, 2 to 3, 3 to 4, 4 to 5, 5 to 6, 6 to 7, 7 to 8. And because you started from 1, so your circuit is over. Got it? Makes sense, everybody? Yes? So with this, you have a break, and then either it is the first, circuit is the first, or the long case is the first, but the last 3 exams, long case was in the morning and circuit was in the afternoon. Am I clear about the outline of exam, please? All the past topics will be with you guys. I will solve it myself. I have updated the February 2026 batch course as well. So I have made the changes that we will do module-wise the discussions. For example, table-wise discussion, 1 maternal medicine, 1 surgical case, 1 labor case. So whole sessions will go in a way that you will complete your 1 cubicle. So 1 session done, 1 cubicle done, 1 session done, 1 cubicle done, 1 session done, 1 cubicle done. So it will be very, very organized. You don't have to worry, but the pattern or the regular course for the February will start after your results. The daily discussion will start. Walaikum assalam, Susan. Thank you very much for joining in. Regarding the fast track, as you have received the details of the introduction, you should know that the fast track is very important, but you have to have the understanding of what are the important cases which should not be missed, right? So with this situation, my expectations are that you guys exactly know what should be the schedule like, what should be my daily, how many stations I have to do, and what would be the expectation out of last 6 to 7 exams, what I need to cover. Reason for that is, hello Anam, how are you? Anam, we started at 3 p.m. GMT, my love. So your schedule is starting from tomorrow. I'm talking to the fast track people now. Before that, all those who are messaging for the links. So 1 second, please. Sai, can you please put the link in the booster group? I forgot, I think, and now students are messaging me, ma'am, we need link. Can somebody put the link in the booster group, please? And Sai, if you can put in the Telegram fast track and Telegram regular September as well, my dear. Yes? Somebody can do that from them? Okay, great. Thank you very much, my dear. All right. So now you guys know it's not the same link, my dear. All of you, please pay attention. I'm talking to the February fast track people. Before that, all those who are asking for the link and who still don't have the link, this is the listener course for the February 2026. And own students, they have their coupon. They can use that coupon. This is the active. Outsiders who have passed the exam, they can definitely have the active link now. But the own students, I'm waiting for their results and then I'll upgrade them to active so that they can start presenting. For fast track, only listener is left. I am overpacked with the active seats. No active seats are remaining, please. However, if anybody wants to come as a listener or as an additional active, which is going to be with the moderator, more than welcome, please. Today we are having the introduction session, everyone. How I'm going to plan the fast track. Now, please note it down. The fast track on 20th of 9. All the fast track, please pay attention. The students in the fast track, please. I am going to do May 25, day 1, and then May 25, day 2. I'm going back to February 25, day 1, February 25, day 2, and then going back to November 24, day 1, November 24, day 2. This means that you would not miss out anything at all for the last how many circuits? Every day, 7 circuit, 2 long cases. 7 circuit, 2 long cases. So that means that from the last 7 into 6, around 42 plus circuit stations, your exam 5 to 6 will be from there, and then you have the regular basis as well. Nothing would be overlapping there. Every single content is being sold by me, would be corrected by me, and I want that to be on your tips. This is that final rehearsal where I want you guys to be perfect in your applied clinical knowledge. The daily schedule you guys have already received. The way you guys are going to do date-wise daily schedule for the fast track November 2025, I will be very strict with you guys. Every single case has to be on your tips, and you would see that everything will be fine. Every single station before 2024 is covered in the regular course. All the regular course is covered with May 2024, February 2024, 2023, 2024, even 2021 as well. All right. Okay. Anu, can you be on the mute? All right. Got it, my dear? So daily schedule is shared, Anna. Please see the daily schedule, and I'll be very, very strict in the daily schedule because the daily schedule would be, guys, almost every single station is an expected station. Now, in the last fast track and in the mock exams, when you guys would meet me in the mock exams, I will give you the final guest topics. 90% of the time, the mock exam stations are all in exam, and students are always like, ma'am, we just passed through this rehearsal according to what is going on. So sure, Anam, just tag Binte Hawa there. She's going to post it for you. Right? Farah not posted in the fast track? All right, probably they were waiting for my approval, my dear. Will be posted tonight because tomorrow is the first day of your first topic. So what do you guys want? One topic daily to be given, or the whole fast track schedule should be posted so that you can organize yourself and you know? Because the whole fast track are the last 6, 7 exams. One daily or the whole should be posted, and then the scenarios would be. So I've told the moderators already, let them post the whole PDF, right? After that, what you're going to do is that the scenario of the exam will be posted one day before, because there are only topics, right? So what came, what case came, what were the questions, you're going to do it from that. And every day, one scenario would be posted according to the topic, and you guys would follow that. Am I clear? Did you guys get it? Ruhi, Anam, Claire, Shweta, Soumya. So let it be that you know all the topics, but daily scenario one will be topic because the topic won't be there. Daily one scenario would be posted, which would be the exam scenario. You're going to solve that. You're going to put your recordings, and then you'll get the feedback on that. And I will tell the moderators to mark and score you. Anybody doing the repeated mistakes, definitely I'm going to highlight that in the sessions, because after fast track, we don't have any sort of leniency from our side of being a soft corner, because it has to be very, very strict, because we have to clear this exam, and that's the last throttle that I can give to you guys. Okay, they would be exactly so, Sonia. It has to be domain-wise score, and if somebody is failing, it has to be known that it's a failing station, so that you exactly know that now where do you guys stand. can't be sugar coated from this point, because you have to understand that what I have to do in this two to three next sessions. All right. Farah, do me a favor, please. Now, again, mobile is popped up with the regular students, the link of the fast track. So, and then they will post daily one scenario. Yes, according to the session. So Mia, anybody please post it in the regular November group, the fast track link, please. I'm sorry, I just posted in the premium groups. I forgot that other people wanted to hear because it was introduction. Somebody can post in the regular group, my dear, please. Other than the fast track, I just posted in the fast track. You shared? Oh, thank you very much. Thank you, my dearest. Shami, you also shared, yeah? I think Mehnaz just joined. So it's shared now. Thank you. Let's do a sample station. It's a recent exam station. I just want a volunteer role player. I'll do the role play myself. I just want a volunteer candidate who is going to take the station. Shazil, you wanted to do that? Just one station to mimic and to see that how it goes. Shami wants to do. My pleasure, Shami. I'm so proud of you. All right, can I have your camera? Thank you very much. So
Hi, can you see me?
yes, absolutely, my dear.
Hmm.
So, how to introduce yourself, how to enter into the cubicle, do you know these things, or is it okay that you'll do by yourself and then I give the feedback? Because we've not started the preparation, so I do understand. Yeah.
Um, I'll start and then maybe people can learn from my mistakes. So,
But that's absolutely okay. And I love this attitude and no inhibition. So the 10 minutes, they start now.
good morning. I am Dr. Shami Vijayadasa. I'm one of the exam candidates today, and this is my sticker number.
Thank you very much. And please go ahead with your patient's task, and role player is here to talk to you.
Okay. I'm done reading the case report. Can I start?
Absolutely.
Okay. Hi, Mrs. Sarah. Is it okay if I call you Sarah?
That's okay, doctor. I'm really
Okay.
concerned about the ultrasound report. I'm sorry. I just saw that the nurse didn't have some comfortable expressions. Is my baby okay?
Right. Hi, Sarah. I'm Dr. Shami, and I'm here to answer all your questions. First of all, take a deep breath, relax. I will answer all your questions one by one. You're 35 years old, and this is your first pregnancy, correct?
Yes, this is my first pregnancy, and I just had some blood test, and they said that it's a routine blood test. It has to be done for
Right.
every patient. So I just underwent that. And after that,
Mm.
I don't know, I just received a phone call that I need to see you. I had an ultrasound as well.
Right. If you don't mind me asking, may I know why, how many years have you been married for?
Married for, I think, it's been 2 years of relationship, around 33
Mhm.
years.
I'm sorry, 2 years of marriage.
I'm not married. I've got a
Oh, I'm
partner.
sorry.
Yeah.
All right, 2 years. So may I ask why you is this a planned pregnancy or
We both love each other. It's a planned pregnancy, yes.
okay, all right. That's nice to hear. So you had gone for your early scan, and unfortunately, there has been an anomaly which has been shown on the scan, and it is in medical language. It is called an omphalocele. It is a defect that occurs on the tummy of the baby, which occurs on the side of the the umbilical cord. Do you understand the umbilical cord,
I
which is
don't.
attached? Okay, so there is a structure which attaches the mummy to the baby, and that's how the baby receives all the nutrients from the mum. So there is this the intestines of the baby are outside of the abdomen, which is next to the umbilical cord, as I just explained. As this anomaly, I'm sorry, I understand, Sarah. I'm here to help you through this.
That means my baby's going to die.
No, it doesn't mean that. It doesn't mean that. But
That
for
means
sure,
my
it's a.
baby's alive.
Can I offer you some water?
Thank you. Can my baby survive?
Um, so after this anomaly was found, we also did a test about genetics, and it is found that the baby has a genetic disorder as well. So I'm really sorry, Sarah. Sarah, have you come by yourself, or do you have somebody with you? Are you alone?
I thought it's a general talk. My partner doesn't even know that it's going to happen, doctor. I'm so worried. We were so
All
hoping.
right.
We started doing all the we bought so many clothes for the baby, and we never thought that it's going to be this way. Why, doctor? Why this happened with me?
I know. I'm really sorry, Sarah. Would you like me to wait for somebody to come and then I can speak to both of
No,
you together, or do you want me to talk to you right now?
no, you've already informed me everything. Now, please tell me what's the way forward. What do we have to do?
Right. Unfortunately, the genetic disorder which has been diagnosed in the baby is not compatible with life.
What? But a little while earlier, you were saying that the baby would survive.
Um, No, what I meant is that it is when I say not compatible with life, what I mean is that a baby born with all these congenital anomalies, these babies have a very difficult life ahead, and their survival rate is very less. So it's a lot of trouble for even for the parents to see their baby go through all the difficulties once it's born, and so usually the advice give the patients is
Sorry, doctor.
to
So easy
try.
for you to
I know.
say all
I'm
this.
I'm
I'm
really
so
sorry, Sarah.
It's so
I'm
easy for
re-
you to say all this, but this is my very precious baby. I want this baby.
I know, Sarah. I'm really sorry. I'm really sorry.
By any chance, do we have any medication? I can go anywhere, any treatment at all.
We can take advice from a pediatric surgeon. We can consult them, and we can find out if anything can be done about this. But we'll do everything best in our capacity.
Doctor, I
We'll
have a question.
Yes,
Any chance it might be a wrong report? I mean, are you sure
yes.
that my baby is having this problem?
So this is just a screening test, and there is a diagnostic test which is known as amniocentesis. Are you aware of this test? No. Okay, Sarah, I'll explain it to you. Amniocentesis is a procedure where a needle is put into the mom's tummy, and a little bit of the fluid in which the baby is removed, and it is tested for genetic abnormalities in the lab. All right. So that is a confirmatory test. That test will give you a confirmation about the genetic disorder. This is a screening test. It means
While earlier you were saying that the baby's been diagnosed with this.
the baby has these features. It has a condition where the baby's intestines are outside of the body. That is what it shows. But the genetic disorder, we can confirm it through this test called amniocentesis.
Okay.
Mm. And for the intestines being outside, we can consult a pediatric surgeon and see if anything can be done, and we can do the diagnostic test to diagnose the syndrome, the genetic abnormality.
What do you want me to do now?
Um, um, my next advice to you would be, if you can come with your partner, and we will refer you to the pediatric surgeon, and we all can have a conference together, and we can talk about what can be done further for your baby. We'll do everything in our power, to do everything for the baby, and to make you comfortable and to help you through this. Um, do you think you need to talk to somebody like a counselor or a therapist? Do you need information about any group support groups? I can help you with all of that.
Sure, doctor. Thank you very much.
Would you like me to set up an appointment with a therapist, or you would like to join a support group? Okay. So I will give you information on that. I have pamphlets on it. And we will also be referring you to the fetal medicine unit. So I want to know if you want to do this today all by yourself, or you would like to bring your partner and then we go ahead with all of these steps.
Is it all urgent? Has it to be an emergency now?
No, it doesn't have to be an emergency. You can go home, you can speak to your partner, and you can share, you can grieve, and you can come back. And you
Thank
can take your own time. Um, but I would advise you to come back within within 2 weeks at least.
Thank you very much. 10 minutes are over. What an amazing station. Thank you very much, Shami. Up and down, up and down. I had to bring you back to the station, but I'm so glad on the confidence and I'm so glad of managing it. Loved you. I told you, I sent one voice note to you, remember? That people like
Yeah.
you should not have a difficulty for OSCE once written exam is clear. So imagine that you are MRCPI done. Thank you so much,
I'm
Mari.
so thankful. I'm so thankful to the people who kept sending messages down.
Yes.
Pediatric surgeon support
You know,
group.
that was not a diagnosis. It was not this. I mean, I kept on seeing that. Yes, it was a very difficult role play, but this is how, Shazil, my dear, this is how one SPT is because they have to see the communication. Rest of all the stations are structured discussion. So amazing, very well done. And I'm glad I've got a huge list of the positives and the appreciations. First of all, friends, it was so random for a student who has not taken even the regular course. I am so happy, glad, and hats off to you. I'm proud of you for your efforts. I was happy in the starting up, Mrs. Sarah Brown, and giving water. I know lots of prompts were there, but I was happy that she gave me water. I was happy that she offered tissue. I was very happy that she did go ahead with the discussion of FMU, though it was again a prompt. But again, I'm very happy that she was picking it up. She had the control over herself. And again, correction of screening test was really good, though explanations were not there. But I'm not expecting at this point that you guys will be perfect, of course. Let's do the points where I wanted her to be better. Very well done for that. Generally, in communication with the patients and relative, I avoid good morning myself because you never know that SPTs are not in the morning. SPTs are in the afternoon. So I generally am not in favor of good morning or good afternoon. I'm always in favor of hi, hello. That is a better way of speaking because often students they keep on doing with hello, hi, then it's okay. But if they're like saying good morning and it's on the second part, so of course the time zone gets different because they're practicing like that. So suddenly speak like that. It's better to say hello. I'm Dr. Shami. I am here for the my case scenario, and the examiner would say, please read the instructions. So the starting was okay. That this is my sticker. Age was not confirmed in the beginning, so I always prefer starting up with, hello, Dr. Shami, I'm one of the doctors in the clinic today. Am I talking to Mrs. Sarah Brown, 35 years? Is it okay? I call you Mrs. Sarah, right? So this is an introduction. Then you make an agenda. Agenda is that why did she come here today? All right, so Mrs. Sarah, I've gathered from your case notes that you're here today because you have undergone a blood investigation and an imaging ultrasound, and you're here to know about the reports. Am I right? So, first you do intro, and then you do agenda. Agenda means why she is here, for what reason it's here. Okay, so it has to be this. Moreover, when she is saying it's a planned pregnancy, we are happy for that. We do not congratulate this. Why? Because it is an anomaly. So we know it's a sad thing for which we had to take. So we don't have to do congratulations in this case. I would avoid the phrases like "please take a deep breath" from the start because it's a little uncomfortable for the patient to listen to this. When you're appearing in OSCE exams in UK and Ireland, so we always avoid the word marriage because we just have to say relationship because every relationship is a relationship, but every relationship is not a marriage, right? Marriage is a relationship, but relationship is always not a marriage. And listen to Shazil. He's residing in Ireland, guys. So Shazil says partners due to more tax. So, so it's always fine to have a partner and do not have a marriage document, please. So otherwise it's gonna be full of tax and home. So thank you very much, Shazil, for telling the other factor as well. So what we always say is that since when are you in relationship? Did you get it, Shami? Right? So this is a very important aspect, and you always can ask through this. Basically, what Shami wanted to ask was that since when we are trying for a baby, or since when we are planning for a baby, and she just wanted to gauge that this pregnancy is after how much time. So you can always ask it like, since when are you in relationship, and is this the first pregnancy? So you understand that how much time did the couple take to have a pregnancy. So I just wanted to prompt that. That's why I just said that I'm not married, so that she knows that this is one of the mistaken exam. Then I don't know what did I say, but I've written here. She said nice to hear. What was that, guys? On my one answer, she said nice to hear. What was that? Anybody remembers? During our talk,
That
I
was
gave.
about the planned pregnancy.
Oh, I see. Okay. When I said it's a planned pregnancy, she said nice to hear. So today, no, nothing is nice to hear because eventually it's a trisomy 13. Okay. So these words we have to avoid saying that nice to hear because this gives again a false hope to the patient that everything is okay. Now, I wanted you to complete the history, the medical, the surgical, lots of history, because one information gathering was one of the domain and we couldn't complete the information gathering. Nothing was asked in the information gathering, and immediately we went to the breaking bad news. Right? Oh, I see. Anam says, when I said we love each other, she said nice to hear. I know it was nice to hear, but not today, right? Because today it's a breaking bad news. Okay. So information gathering was failing because we didn't take the information gathering, friends. There are lots of data in the information gathering. I'll just show you the slides now and you'll understand. Communication with the patient wise to consider just a start, very confident, picking up the prompts, being very positive. More or less, the explanation was okay, but I wanted a little more explanation of what trisomy 13 is from the building blocks, thread like structures. I'm going to do that now so you guys understand that what is the expectation of the examiner. She did mention FMU, which was the basic communication with a colleague, and I'm super proud of that. The main thing where the applied clinical knowledge was going wrong was telling that she has got trisomy 13. Please don't do that. When it is NIPT, it is high risk for baby to have this. Okay, so it is high risk for the baby to have this is an important thing. So we had to tell that the genetic abnormality highly suspected in this case. And the diagnostic test was CVS versus amniocentesis. She was 13 weeks. So we can do 11 plus 13 plus 6 is the time, right? Or amniocentesis. FMU and in the NPIL and support group was very, very good, which she did. However, the whole scenario had to be systematic in counseling. Communication with the patient had to be complete breaking bad news. What Shami said in the end, that do you want somebody to be with you? That was the first warning shot as per examiner. Right? Okay. So how we are going to do the history, you take the history of presenting illness first. So do you want me to do the station first and then I'll show you the content? Is that okay? Everyone, let me do 6-7 minutes that how the station should be. You guys would understand, then we'll move further. Okay? All right. Let's begin. Okay, so we'll just take the station as Shami so that you guys understand that what the description should be. Just give me 1 second, guys. All right, the MacBook said, please put me on charge. All right. Hello, I'm Shami. I'm one of the exam candidates, and here's my exam sticker. All right, I'm ready to read the instructions, please. I'm ready for the case. All right. Hello, I'm Dr. Shami. I'm one of the doctors in the antenatal clinic today. Am I talking to Mrs. Sarah Brown, 35 years? Is it okay I call you Mrs. Sarah? I've gathered from your case notes that you're here today because you've had some blood investigation in your first pregnancy and an ultrasound as well. Am I right? I can see that you're quite anxious. I would like to discuss all the possible management options with you. However, before that, would like to ask few questions if that's okay. Can I proceed, please? Thank you very much. So, Mrs. Sarah, can you tell me more about this pregnancy? Mm-hmm. Okay. So you're 13 weeks at the moment. All right. And it's a planned pregnancy. I see. Okay. And so far till 13 weeks, any problem at all in terms of any bleeding, any discharge, any sort of an admission? Nothing like that. All right. Any sickness, any vomiting? Did you take your folic acid? I see. All right. And any other concerns for your health? Nothing. Any flu, any fever? No. All right. Okay. So, this was a planned and a spontaneous pregnancy. May I know when did you start your relationship? I see it's been 2 years. Okay. And your partner is generally fit and fine? All right. Okay. If I just ask you little details about your general health. So, any medical problem for which you see GP regularly? No. Any sort of a surgeries which you had on the tummy or down below? No, okay. If I could confirm that any family history of concern, especially for the pregnancy abnormalities or any concerns with the baby in the family? No, all right, okay. And if I could confirm your blood group, that's A positive, all right. Any concerns with the blood transfusion, any reservations at all? No, okay. And if I could confirm any known allergies, please? No. Do you smoke or drink alcohol? All right, Mrs. Sarah, any recreational drugs? I'm sorry to ask this question. No. Okay. And how had you been feeling in the last few weeks and months, and everything's been okay? You feel yourself to be well supported? Do you consider yourself a happy couple? Okay. Thank you very much for all this information, Mrs. Sarah. I would like to examine you in the presence of a chaperone, and if I could double check your weight to height ratio BMI as well. Thank you very much. So, Mrs. Sarah, I can see that you're here alone today. Would you like somebody to be with you? I'm afraid that I have a difficult news to discuss with you today. Can I proceed? I've confirmed your name and the hospital number on the blood test and the ultrasound investigation as well. And I'm afraid that the screening test that has been done that shows certain abnormality of a genetic disorder. We call it as the TORS syndrome, trisomy 13. I'm here to explain to you further. We all are made up of building blocks that are cells, and they contain thread-like structures. We call them as chromosomes, which contain genetic information. Now, every cell has 23 pairs of chromosome, and that makes the total count of 46. However, if some extra coding is present as an extra chromosome, we say that it's a trisomy with an additional piece of information on the 13th number. This adds on the abnormality of some facial defects, some sort of a defect in the abdominal wall of the baby. I'm extremely sorry to inform you that the ultrasound does confirm the same. that the abdomen does not develop fully in this case, and the intestines of the baby, the gut of the baby that's coming outside, it's covered by a membrane. We call it as exomphalos or omphalocele. Please take this glass of water. Please have these vibes. I'm extremely sorry to be the bearer of this news. I wish I had a better news for you today. I know that this is not what you were expecting to hear today, Mrs. Sarah, but I would like to reassure that we as a team of doctors are here to support in this difficult situation. We're going to connect you to the counselor as well and the support group, but I would like to confirm that in this situation, we are not in a position to continue the pregnancy. If you want to continue the pregnancy, we have to be honest to you that it might not be successful pregnancy to move further. Even if the baby is born, would not be able to survive. I'm sorry to inform you with complications in this case. Generally, this abnormality is a life-limiting condition. I know it is too much to take in. We will be confirming that through the investigations, as the investigation does reveal that it's a high risk for having this condition as per the screening test. So we do have option to have the test from the afterbirth or from the fluid around the baby. However, diagnostic test, but definitely we are going to do it further so that we know that what exactly is the condition and we take it further. Are you following me? I know you're thinking about the options, and we are here to give you the options, either ending up of the pregnancy at this point after confirmation or continuing the pregnancy. But in both the cases, we are here to support you. It will be your choice. However, again, we are going to refer you to the expert doctor that how the things are and how the team of specialists talk to the FMU are going to take it further. The prognosis will be decided and discussed with you further. Is that okay for you? Any questions for me? So I want you to take your time, read about it. I'll connect you to the support groups as well. Would like to see you with your partner as well. My consultant would be here. The specialist team will also talk to you. And then take your decision knowing about the pros and cons of each. Meanwhile, we would like to book an appointment. If it's in these 2-3 days, we could take the sample from the afterbirth. But if it's going to be after 14 weeks of pregnancy, then we'll take the fluid around the baby, if that's okay for you. Yeah. I will connect you to the group of counselors so that you can pass through this, and we will be here to support in all situations. Is that okay, Mrs. Sarah? Anything else I can help you with? So is that okay that I see you in 2 to 3 days' time with your decision? Yes. Meanwhile, I'll fix an appointment for the confirmation and the baby doctor and the specialist team, the FMU. Is that fine? Thank you very much for talking to me today. We are right here to support you. And for the upcoming pregnancies, we will do the genetic referral earlier, and we will give you all the possible ways for the healthy pregnancy options for the future pregnancy. Thank you very much for talking to me today. And I'm sorry once again for this difficult situation. Thank you very much. Okay. This all had to be spoken, Shami. This all was part of the key that had to be done. You have to speak about what trisomy 13 is, right? You have to tell about that. Don't give false reassurance. When we say that the baby has this condition, is high risk to have this condition, and then she says, okay, is it a chance that my baby will be fine in the diagnosis? So then you have to be very clear. I'm sorry, it's very unlikely because it is going to be omphalocele and then this. The whole applied clinical knowledge was CVS versus amniocentesis, and the choices were termination of pregnancy or continuation of pregnancy. However, it's her choice. We give the choice because if she wants to continue, we can't force her to end it up. So it is very important that you do the patient safety complete. Do not forget the genetic referral for the future pregnancy. The breaking bad news is going to be 3 complete warning shots. I can see that you're here alone today. The examiner does tick. You score it. I'm afraid that I have a difficult news for you. And then not sugar-coated open news. So 3 points are very, very important from the breaking bad news. Avoid jargons, rapport building, empathy, non-judgmental approach, breaking bad news for the communication with a colleague, genetic referral, future pregnancy. Don't forget, it's very important. Support group, specialist, midwife for the treatment plan, consultant, FMU. If you miss out on each domain, friends, examiner has got domains in front. And if you miss out on the domains, that domain gets failing. For example, here I said that information gathering was failing because we didn't ask that. All right. Isra, third is speak. Write it down, guys. If BBN is the most common one, all of you. Number 1, I can see that you're here alone today. This is known as warning shot 1. I repeat, I can see that you're here alone today. Warning shot number 2. I'm afraid that I have a difficult news to discuss with you today. I'm afraid that I do not have a good news, depending upon what news you're going to tell. This is warning shot number 2. Every step gives you score, guys. Number 3. I've confirmed the name and the hospital number on your reports and they reveal. Give open and transparent report. Please do not do sugar-coated wrong report. And then in the end, the grief reaction. Please immediately do not tell all the options. After telling the news, you say, please have these vibes, have this glass of water, speak in the heart. 1, 2, 3. 3-second pause. This is known as giving the grief reaction to the patient. Okay? Everybody clear? Got it? That's great. Thank you very much. Thank you. Understand, Shazil, my dear, first is I can see that you're here alone today. This is the first one. Got it? Okay, great. Did you guys understand? Now, each and every case in the fast track, I'm going to do it myself for you guys because those stations, I want you guys to have a perfect key in your head so that you listen to the recording and you speak that and you know the empathy, you know the details, and you go ahead with that. Make sure that you guys know that what is the way of the SPT because it's one SPT. But I had to tell you that how much is important every single station. Nobody asked me, do we have a chance of failing some stations in the OSCE? I mean, we have a circuit. And if yes, how much? Only one. Thank you very much. You should know that only 1 out of 7 we fail. If we fail 2 out of 7, you get an email that your 2 stations were not meeting the standard and it's a failing result. Okay, similarly, we have got 1 long case. And that 1 long case has to be a passing long case. You do not have a chance to fail the long case because we don't have a second long case to compensate for that. Clear, everyone? So passing marks is more than 80% of the scorecard should be touched. If you touch more than 80% of the scorecard, you are passing. I mean, the tick points, as I said that this was, as I've shown you the scorecard. Got it? This is very important. So knowing about, for example, you have mentioned CVS, you have mentioned amniocentesis, you have mentioned for the communication with the colleague FMU. You're clear, you're passing, right? So she would have lots of questions regarding CVS. She would have lots of questions regarding amniocentesis. It's okay, you keep on addressing the concerns, but you should know that the basic thing has to be clear in your point. Now, what I'm doing for the fast track is for you guys, because now these are the final rehearsal before exam. I want you guys to be so clear regarding the content. For example, omphalocele from the written part, you guys know that omphalocele is a must question in exam. College loves omphalocele and trisomy 13. College loves trisomies. So the whole scenario I'm trying to put on one slide with one point that, okay, you should know the sequence of speaking and you go ahead with that, right? So that would be helping you guys for exam. Would try my best for every station, do it in this manner so that in the end, and the literature would be given to you in the study group. The moderators are going to give you the patient information leaflets of TOS. They're going to give you the detailed content that this is you have to read. That's why if you see the daily schedule, friends, I've put in the notes section separate, that what is the content from where you have to prepare this so that you can go further with that. All right. Okay. Any questions, please? I'm happy to have the questions. Anything regarding preparation for the new batch and anything regarding the fast track, which you guys want to know, please let me know. I'm happy to have all the questions here. Thank you very much. It was
Ma'am,
just
fast track timings, ma'am.
so Farah, let's do it now. Few of the students said morning, few of the students said evening, right? So the 20th
Yes.
one, where is the September? Okay, so evening. 20th one, we can start from evening and then morning, 24th, and then evening and then morning. Is that okay? All of you, is that okay?
Good.
Shazil,
Yes,
good.
ma'am. Okay.
Because it's Saturday, So, and then it's going. So let's do it 2 p.m. and then 5 a.m. or 6 a.m. I can discuss in the group with you guys. But I have a question. The confirmation you guys are getting by 15th, no, 15th, 18th, 20th. I hope 20th we'll not have to postpone because all the students were saying that we want to freeze it if we don't get it. Farah? So far
Yes, ma'am.
20th.
Actually, I spoke to Dr. Sana as well, and she said we are expecting confirmation by 22nd of September sometime.
Oh my. So the first session also we'll have to make delay. All right, 22nd
Yes.
session, and I'll do it early. I can't do anything because people were saying that if we don't get the confirmation, we would like to fast track. But after session,
Yes, ma'am. We all were exactly. We were all thinking the same. That in that case, if you take session on 20th, then we have to
because
temporarily
see,
freeze it, ma'am.
The February fast track would include the November exam as well. So definitely, if you're not appearing in
True.
November, this
Yes,
fast
ma'am.
track should be on freeze. It's not helpful for you. You should take the
Yes, ma'am.
fresh fast track when you're appearing in exam. Yeah.
Exactly. Exactly.
Mom, we didn't get it. The first session in 24 or 28?
It was 20th, right? As per the schedule, Farah?
No, 24 it is written.
Yes, ma'am. 20th, as per the previous discussion.
Yeah. So it's 20th and 24th, my dear Sra.
So their session in 24 will be morning time, the 24, right?
So yes, it will be morning time, but now I'm afraid that the 20th one will not be there. Only 24th will be there if at all still we don't get the seat, yeah?
Ma'am, I have a
Exactly.
question.
Ma'am,
Yes, Ima.
Actually, is it possible to get late confirmation of seat? Because sometimes a
Every
few
time.
of the seats are postponed.
Every time. First seat when it is going to be announced, if that's 20th or 22nd, every student will get 3 days to make the payment. The ones who will not pay, it will go to the next.
Okay,
So,
perfect.
so every 72 hours, new people they get the confirmation, and it keeps on going 15 days before the exam.
so ma'am, we can do
So
that.
what if we do for freezing
Guys,
after
I have a
after
very,
not
very
getting any
clear, I have
confirmation?
a very, very clear answer to this. If somebody is in the live session, that would not be on freeze, please. I cannot freeze that afterwards.
So, ma'am, till now we have option till 19th.
Till before the first session, and I will delay the first session unless the bulk gets confirmation because I have to start
So
the
ma'am,
fast.
we can take it the first session on 24th and second 28th.
Yeah, I can do 28th. Yes, I have slot on 28th.
Yeah, because till that, hope so inshallah we'll get confirmation.
I can lock it for you guys now before the moderator puts some other activity for me.
I
Okay.
think we can start the Telegram one and we will start preparing the sessions, but we'll take the live on 24th.
Still, I'm very flexible with the Telegram thing, because that also is moderators app, but I want that whosoever would be there, at least you start preparing. So Telegram discussion is starting tomorrow, guys, okay? Yes? So tomorrow it is starting, and the first topic for the May exam that's going to be started now, and then we are going to move further for this, right? But if till 20th you guys are not getting, then we'll have the 24th first session. If you get it, I'm ready. I've prepared the first session. First session from my side is prepared.
Okay,
So
ma'am, inshallah.
but if you have attended the fast track, and then after that, please, I won't be able to freeze because then you have to continue the course. So you will get as soon as you get the acceptance. And the ones who are not getting the seat, all of them will be shifted to the February if it's on freeze. The freeze mock exam also, please freeze it. Shift it to the Oman mock exam, and the May exam if Ireland people they don't get seat, shifted to the May Ireland. But all those who are getting seat, they will be there. There are 50 people plus in the Riyadh mock exam, please. All of you, please, whosoever gets seat, please attend the mock exam. Otherwise, please shift it to the Oman mock exam. Okay? Right?
Ma'am,
All
how
right.
many
Yes.
maximum candidates in the exam per day? 2
So
days we have the exam.
4 batches to 6 batches. 6 into 8. 6 multiplied by 8.
48.
6 multiplied by 8. 48.
48.
So 48 minimum, and at times they have 64-8 batches as well. So it depends on A, B, C, D, E, F, G, H, I. So it depends upon how many registrations are there. But 6 at least they take. A, B, C, D, E, F. I mean, that's every time they have this much batches.
So, ma'am, per day candidate will be 48. So we can double that, right?
Yeah, for one site, yes, at least this much. They can increase it to 60 as well. In Oman, we were having 60 batches or more.
Ma'am, how's the passing rate of Saudi, ma'am?
It's good, Shweta. It's good. Saudi has always got good passing rate, even Oman. RCPI overall has got very high passing rate, friends. Very high passing rate as compared to Mrcpi 3, very good passing rate. And Riyadh is a very good center. It is a good center. You don't have to worry about that.
Hello, ma'am.
Hello. Yes, my dear.
How are you, ma'am?
Thank you very much. I'm good. How are you?
Fine, alhamdulillah. Ma'am, just I have to ask you one thing that we are for this one Feb. So we can apply for this one fast track or we are not?
So first let the regular get
Result come.
No, first the result come, then regular shifted to active, upgraded to active, and
Yes,
then
ma'am.
fast track will be started around January start to December end. Then I'll open the registration. First do one.
Okay.
First
Yes,
understand regular is going to be the basic course for you guys. Once you get
okay, ma'am.
then we'll start the fast track. Okay.
Dr.
Okay,
Sidra,
ma'am.
what we should do in this fast track
Ma'am,
right now if we are attending classes with November batch?
No, you guys are not attending classes for November.
We have
You
separate
have-
classes, or we are going to get through the library?
Yeah, you
What
will
we are
have
going
the library only. On result, your daily discussion will start. Daily
Okay.
one station practicing in moderator feedback. That would the
ma'am.
schedule will start on your result day, Sarah. Okay.
Okay.
See,
Ma'am, one another thing that in the short circuits, even when there is already given the patient's age of the patient and name of the patient, is it must when we are going to in interaction with the patient, again we have to ask the name and the age? If it is already given, the age is 35, name is this. So we have to say, as I have seen your scenario, your name is like this, your age
you
is.
have to say that because that gives you score. It is a patient safety that you are confirming the identity.
Oh, okay, ma'am. Good. Thank you so much, ma'am. Thank you.
Thank you very much. Thank you. Any other question, please?
So, Sidra ma'am, the
Yes,
people who
ma'am.
are awaiting the results, we still just keep reading the short, long cases in that ebook thing, right?
So at the moment, just follow the index and keep reading one topic. Whatever are there, they are the possible exam stations, right? So they are expected.
Right.
However, it's just like you should know that how the content has to be spoken, how you should be knowing. The way you have done today was beyond my expectations because you knew how to, you knew the sticker thing. I was amazed on your start. So that's really good. So that means that you get, at least you're getting the hang of the OSCE, right? And then we'll
Okay.
portal as soon as the result comes, okay?
All right. Okay. Thank you so much.
Thank you very
This
much.
February batch should discuss these stations in the group that we have made in WhatsApp, or we should keep on discussing with our friends and then it will be activated
No,
after
I think you should,
announcement of
if
result.
you personally want to discuss, start reading together in the WhatsApp. It's better. Like, for example, Shami, you can say that let's read this to get together. So it will be a good thing. However, I will give you the moderator on the result day but already you guys are studying. So study as a group. I think it's better, always better, Sarah. Let's do this one topic today. So, it gives
Yeah,
everyone.
that's a lovely idea, actually.
Yeah, it's really good. For example, you start with an index, tomorrow you start with the first. Okay, let's do this, guys. What can be the possible questions? Let's discuss the ebook. So your memory would be better, right?
Oh,
So start
okay.
this way, yeah. Okay, great. Thank you very much. Thank you very much, everyone. Just wanted to get connected to the batch where I've finished the regular session last week and they were waiting. November batch, you guys are my responsibility, but I'm going to be very, very strict with you guys because I'm having sleepless nights making your PowerPoints now with all these mnemonics and with all these animations and with all these one page solving station. On one page, I'm putting in all the station. I expect very good passing result because I'm working really hard on this new updated fast track for you guys. I really want that the results are positive and we have very high scores on that. I need your cooperation in this, and I need that with this, your response is 200% when the mentor is giving 100%. All right. Thank you very much.
Ma'am,
Before you go,
Yes,
before you
ma'am,
go,
I have a query.
I really want to thank you for letting me participate, although I was a very raw candidate. So thank you so much for that.
Thank you so much, my dear. My pleasure. Thank you very much. Thank you. Yes, Fatima, you were saying
You are
something.
not raw,
Yes.
Shami. You should know this. You're not raw.
Sarah, you're hitting you guys. Yes, it's Shami has got extra eyes. Yes, yes,
She's not
Fatima.
raw, but
Ma'am,
she's
I want to ask. Ma'am,
Yes,
I want to ask, like, how many stations should we do, like, on a daily basis, like, for a practice? At
for
least
you
how
guys,
many?
at least 4 stations a day for you guys, at least now.
Okay, ma'am. All right.
Okay,
And ma'am, what is the passing rate of Ireland?
very, very good, Fatima. Very good. And when you do the mock exam in Ireland, you'll understand
Yes, ma'am.
there will be like, you will feel that, oh my God, it's exam is a rehearsal. Yesterday,
Inshallah, inshallah.
Today
Inshallah.
also, one of the Irish students, she joined the mock exam and she was saying the same, that I had listened to this repute that when we go to the exam, it seems that, we have passed through all this. It doesn't seem anything new. That is the idea and beauty behind OSCE. So hoping that after this fast track, you guys will be very confident and I'll see you guys in Ireland and hopefully you all will be super confident.
Dr. Sidra, I want to ask a question.
My dear,
Uh,
yes.
can we can we use a pen or paper there to make our agenda or to
On each table, pen is there, A4 sheet is there. You
fine,
don't
fine.
you just carry your sticker sheet, you move to the next, again, A4 sheets, bundle of A4 sheets and pen or pencil is there on the table every exam.
Are we allowed to make a agenda or scheme for us?
When you do the long
points
case, I
which we
tell
want
you,
to discuss.
yes, when you do the long case, I tell you the complete sheet which you have to make for the long case.
Thank you.
Thank you very much. Thank you. Any other question?
Ma'am, we will have the group same like in the regular course, and some will present first, and the rest will the second.
Presentation list, Anam, daily the team asks me and I daily tell them I cannot give you the presentation because I don't know who is getting the seat and who is not getting the seat.
Yes.
That's the big problem. Once everybody would confirm that we are in fast track and the ones who are freezing, so I do know, then I will make the list and I will make in a way that I listen to you guys maximum. I'll make a very balanced way because I know that fast track seats are very important to speak. So I will
Yes,
make it a
ma'am.
way that you guys are available. Don't worry. Okay.
Okay, ma'am. Thank you.
Thank you very much. Any other question?
Dr.
Any other
Sidra,
question?
please.
Yes, Varda, my love.
Can you confirm how to confirm the identity, the phone number for the patient?
So you
And
say
I have
that.
to ask about this.
So guys, this picture, remember, this is Abu Dhabi's picture of one of the batch with long case. So the batch which is doing the long case with me, the other batch is doing the gynec long case, and then the other batch is doing the circuit. So we divide the students in different tables like that, right? So this is how it keeps on going, and we have all the discussions in the circuits and the simulation. What was your question?
In the point to identify the phone number of the patient and the identity of the patient. How to ask?
So no, you don't have to ask. It's in front of you in the candidate instruction, right? So when you
Yeah.
speak the investigation, you say, I've confirmed your name and the hospital registration number. So what we want to tell is that it's your report. I mean, we are not mistaken. All right?
Yeah, thank you.
Okay. Thank you very much. Thank you. All right, guys, this was an open session. Times it was just to see you guys because so many students from the November batch were saying that we are missing you. I do know that it has been a gap, but we are waiting for the acceptance, and for the February batch, lots and lots of prayers for you guys that you all clear this exam.
Then will this recording be there in our portal? I missed the middle part.
No problem. It will be uploaded on the YouTube. I'm going to share the link of the YouTube. Okay.
Thank you so much.
All right. Thank you very much. Love you guys. Take very good care of yourself. I am so grateful to all those who have attended the live session and all those who had been there. Oh my God, so many participants there. Afra, Aisha, Ala. Thank you very much, Alia. Thank you, Asma Zubair. Thank you, Asmahan, Aisha Zaib. Thank you, Farah, Fatiha, Fatima. Lots and lots of people. Thank you very much to all of you. And I'm keen to see you guys in the next one. Thank you so much. Bye-bye, everybody. Take good care. Thank you so much. I love you all. Take very good care. Remember in prayers. Thank you so much.